So, welcome to the second episode of Now What, a panel discussion series about how the present and future of healthcare marketing are changing right before our eyes and what to do about it. This series is produced by the Shift.Health Network, the infotainment media network for healthcare marketers to challenge their way of thinking and help them lead meaningful change. I'm Jared Johnson, digital business strategy consultant and host of the Healthcare Rap podcast, where, yes, we rap about healthcare marketing. With me today are Haley Hite, marketing manager for AHA Media Group, and Dan Dunlop, principal at Jennings. Haley and Dan, how are you doing today?
Doing great, man.
Great to hear you both and to see those faces. It's nice. These times are just so different. And the first episode of Now What just came out recently. And in that first episode, I spoke with Paul Soblowski and John Marzano about how the COVID-19 pandemic is a catalyst for change in our field. And in this episode, we want to focus on lessons that we're learning in real time as we interact with patients and consumers and how to apply those lessons to take action in the future. So this whole thought of acting now and thinking about the future, knowing that we don't want to get caught up and not prepared in the future. That's where we want to go today. So let me set the stage again once really quick of the new reality of healthcare marketing that's happening right now. Because the fact is, healthcare marketing, most of you realize we are going through a transformative change over the last few years already. Most of you are already looking to optimize your marketing efforts to address the rapidly changing expectations of consumers. And then COVID-19 happened, and it accelerated all those needs. And in the chaos that's ensued, you're likely seeing opportunities in real time to improve your marketing operations, to improve your engagement, your brand messaging, your digital consumer experience, your team structure, and your culture. And all these parts play into a post-pandemic plan. And I'm sure that we all recognize that's what we need to be thinking about right now, but you might not know where to start. So I've brought in a couple of folks who can help us figure out where to go from here and what those starting points might be. So my first question, Dan, I'd like to start with you on this one.
Sure.
So how do hospitals and health systems start creating a post-pandemic plan now so they don't get caught flat-footed when restrictions are lifted and life gets back to some sort of normal after this?
Yeah, it's a heck of a question. And it's a heck of a time to be asking that question. You know, in a normal year, when we don't have a pandemic, say a hospital has an October 1 fiscal year start. Normally, we're finding out what the budget is right before that, or sometimes after the start date for the new year. Then we go into a ramp-up phase where we have our strategy in place, but we're ramping up production. And it's often 2 or 3 months before we hit the ground with any kind of marketing messaging, any kind of content marketing that's supporting whatever the strategic plan is for that year, what service lines we're going to market, what specialties we're marketing, that kind of stuff. And we're not in a normal year. The challenge is what I've gathered from everything I've read about the pandemic and the impact it's having on hospitals. It's going to reduce most hospitals' revenue by 25% for this fiscal year. And I think that's a conservative estimate. So if you normally do $200 million, you're going to lose $50 million of that. If you're a $1 billion hospital or health system, you're going to lose $250 million. And that's really tough to make up. So I think the mindset has to be, to your question, Jared, how do we hit the ground running when this pandemic, when we start going on the downside of that curve that everybody keeps talking about? And the downside will come, and I don't know what month that's going to be, but we need to be prepared for it. Now, going to most of my clients right now and saying, hey, we need to take a day and do strategic planning for the post-pandemic era, they're going to look at me like I'm crazy. They just don't have the time for that right now. So it's a sticky issue. You know, how do we take the time? It's what I call the consultant's dilemma. And Jared, I know you do a lot of consulting. When you're busy consulting, and you and I have talked about this actually, when you're busy consulting and you're full of engagements, you don't have time to plan what's next for your business. So you get through those engagements and you look behind you and you're like, or ahead of you, and you say, oh my gosh, I don't know what I'm going to be doing next. Well, the same is true with all these hospital marketing departments that are dealing with the pandemic. They could very well be in a situation where June comes along or July, and they're not having to deal with the pandemic 24/7. And they're like, oh my gosh, we need to be marketing orthopedics, or we need to be marketing bariatric surgery, actual service lines that bring in revenue, that have nice margins. But we don't have a plan for that. We don't have creative. So the time to be doing that, no matter how difficult it sounds, and it sounds implausible, I get it, but the time to do that is now, not once you hit the downside of that curve. So I think the easiest way to do it, and none of this is easy, but the easiest way to do it is to look at projects you had in the pipeline before this started. You had a plan. You knew what service lines you were going to be marketing this year. You knew, that you were going to be pushing primary care or pediatrics, whatever it happens to be. So get back to those. I think the tricky part is going to be, it's not enough just to produce the same creative you were going to produce 3 months ago. I do think consumers' relationships with hospitals and the way they see hospitals today is different than the way they saw us 2 months ago. And therefore, it's an opportunity. I mean, I think through the creative, we can reach these people more impactfully, because they're going to have more of a connection than they had before the pandemic. So I think creatively, I don't think it's same old, same old. I think you are going to have to make some shifts in the way you present your marketing and the way you present your service lines. So that's my quick thinking on it.
That's great. No, that really gets us going in the right direction, I think, here, and already addresses a couple of the dilemmas, like you're saying, a couple of those blockers, those obstacles that are keeping marketers from understanding what to do next. Haley, what do you think?
Yeah, so I agree with Dan. That's actually a question that we've heard quite a bit at AHA Media from clients of ours, and then also just others in the industry. People are wondering, how long is this going to last? And then when this does kind of die down, which it will, what's life at work going to be like for us? So no one really knows yet how long this is going to last, I think. So it's a bit subjective, my answer in this, but my advice is to make sure you're taking at least 10 minutes a day to regroup with your team, touch base with your team, get together, talk about strategy, both immediate strategy and long-term strategy. Make sure you're all on the same page. But then I also agree with AHA Media Group's president, Ahava Leibtag, her recent suggestion in one of her Writing Wednesday videos. She suggested that marketing teams divide up their days into thirds. So 1/3 of your day put towards the COVID-related campaigns and content creation, things that are directly affecting your job right now. 1/3 should go towards internal and external communications related to COVID. So a lot of, responding to social media from your audience, responding to internal and external communications, emails, catching up with leadership, making sure your hospital employees and staff have what they need to do their jobs. And then also another third just on your other marketing projects that aren't related to COVID. So you're still kind of working on it a little bit on a day-to-day basis. You're not burning yourself out. This stuff's kind of stressful and overwhelming. So I think it's good to get your mind off of it a little bit each day. Do what you got to do, but make sure you're still getting your day-to-day job done, if that makes sense.
And I think, Haley, I think you're right on, and I think Ahava's right on in dedicating a portion of the day to this. I think the problem we're going to run into is the people who are on the front lines, at least from a marketing perspective, are going to balk at 1/3 of their time or whatever, and I think the message is, and I think you're right on, dedicate some time every day to thinking about this, whether that's half an hour or 45 minutes, whatever you can do. And I think the other thing we could suggest is, if you have a marketing partner, like your company, Haley, or my company, or whoever it might be, assign them the task of pushing the thinking forward while you're immersed in the day-to-day and dealing with the crisis at hand. Have your partner put that strategic brief together, start developing creative and messaging that you can use once you're out of this crisis. So use your partners really well, because I think one of the challenges marketing people get into when they're in a crisis is they stop relying on some of the resources they have outside because they're so busy at the hospital.
Mm-hmm.
So maybe use that half hour to call your marketing partner, or to get on a call with your marketing partner and talk about where you want to go, and then turn them loose to be doing that planning that you can't do, or that you don't have time to do.
Yep. Divide and conquer.
Yeah, exactly.
That's the true definition of a partner anyway. So I like just feeling how each of these are kind of starting points, and recognizing that it's going to be a little different, but for each provider, and yet seeing the fact of, they might be asking permission internally among themselves, like, are we even allowed to think about anything after COVID-19 right now? And so to hear this is kind of validating to say, yeah, look, because we know, like, that's part of the apprehension of this whole thing, is that not only do we have to figure out still how to deal with this unprecedented crisis where people are dying in ways that they never have before, then we're also, there's just a pit in our stomach about what's coming next. And so I find this comforting, even just to start thinking about it and talking about it. So I like that a lot. My next question, Haley, I'm going to start with you on this one. If we dive into content in particular, like, what have we learned? Like, what are we learning in real time about content related to COVID-19 as we're going through the crisis? And how can we apply those lessons to our content strategy moving forward?
Yeah, that's a great question. We have seen two big things at AHA Media, especially with our clients and even hospitals and organizations that we're seeing doing things online that aren't our clients. First, make sure you're using credible sources all the time. It's so important right now. It's important all the time, but especially now, because information becomes outdated so quickly. There's so much on the web right now. It's just flooded with COVID content. Many people are just trying to get a word in. They're trying to get something out there to be relevant. But some people are linking to and sourcing things that aren't necessarily accurate, or they're already outdated, or we've seen quite a bit of people linking to and sourcing non-peer-reviewed studies that contradict other information out there. That confuses audiences. It leaves people overwhelmed. It leaves people thinking, I don't know what to believe. So make sure when you're producing content, you're sourcing credible sources like the CDC, NIH, WHO, World Health Organization, .gov websites, peer-reviewed studies. Just focus on that, because that's going to keep you as accurate and relevant as possible. And then the second thing that we've seen a lot of, make sure you are using plain language, because there's so much jargon going around. There's complex terms being used all the time: asymptomatic, pathogen, underlying conditions, incubation period, quarantine. Does everybody really know what those mean?
Good point.
You want to make sure your audience fully understands those terms if you are using them in your content. Explain what they are when you use them. You should be using plain language all the time, not just during this pandemic, but we have to do a better job of explaining what those terms mean, so that, again, people aren't left confused and overwhelmed. It's really all about helping our audiences and kind of easing their concerns and fears as best as we can.
Yeah. What do you think, Dan?
Yeah, I think Haley could do this all by herself. She doesn't need me on here.
I don't know about that, Dan.
I think this is, and I'm probably stating the obvious, but to me, to reiterate a point Haley was making, was it's about credibility, and not only having credible sources, but having a credible delivery of information. And I think even though video was really popular before this crisis happened, I really feel like video has come of age during this crisis, and to audiences where it wasn't as popular before. My wife and I did a video call with her parents, who were like 80 years old, on Sunday, and it was their first time using Zoom, and it was so awkward, but they loved it, and this was their introduction to it. And I think throughout this crisis, a lot of people have been introduced to video and will be introduced to video who weren't involved with video in the past. And so I think as we move forward and we think about content, I think in credibility, I think video is such a strong platform. And one of the propensities that hospitals have is to think, oh, we need to put our administrator on camera, or our CEO, or whoever that happens to be. and I would caution people to avoid that tendency. Have doctors and nurses, actual providers on camera giving facts, because people are so confused, as Haley mentioned. They're so confused about what they're reading. They're getting all different kinds of information. Yesterday, there was a report that, you need to be 27 feet away from people because that's how far those molecules will travel when someone sneezes. Other people are saying 6 feet for social distancing. So what is the reality? So people are confused, and rightfully so. So I think by putting, I was on Facebook yesterday, the day before, working on a piece I was working on. And it was amazing to read. There was a doctor was sharing her story from an ER and her experience working in ER during this crisis in New York City. And I read through the comments, and it was amazing how many people were commenting who didn't believe it, who thought it was made up.
Wow.
It was just unbelievable. And we can't discount that. There are a lot of people out there who think a lot of elements of this crisis are made up. So I think by putting your doctors and nurses on video in their hometown, and they know what hospital you're coming from. If it's Jefferson Regional Medical Center in Pine Bluff, Arkansas, you've got a local doctor there who grew up in that community and who's practicing medicine there, talking to the people in the community about what they're experiencing, giving advice about stay home, don't come to the hospital unless you have this, and this symptom. I think that's the kind of communication that people are responding to right now. It's believable. This is not a time for ads. This is not a time for traditional marketing. I think having your best clinicians talking on video is credible, authentic, and believable. So I think as we come out of this, I think video will be more and more important as a communication tool. It was probably going to be anyway, but certainly this has catapulted video in much the same way it's catapulted telemedicine. Now telemedicine will never go back to what it was. It's going to be a much bigger thing moving forward.
Yeah, but going back to a part of Jared's question, after this is all over, I think your point, Dan, it's still going to be incredibly influential to get those experts in front of cameras and to get them in your content, because no matter what we're going through, if we're going through a pandemic or not, anything health related, they're on the front lines. They know better than anybody, and they're probably the most trustworthy voice. So it's still something to carry forward in your content strategy moving forward.
Agreed.
Yeah, visually, even if you don't watch a video, if you're watching it on mute and it's not captioned, and you're just flipping through your feed and you see a video with a brand and there's somebody who's very clearly a doctor visually, like that tells a very different story of trust. Like no matter what they even say at that point. So even just realizing those visual cues are very important moving forward. So once again, you are tuned into Now What, a panel discussion series about how the present and future of healthcare marketing are changing right before our eyes and what to do about it. This series is produced by the Shift.Health Network, the infotainment media network for healthcare marketers to challenge their way of thinking and help them lead meaningful change. I'm here with Haley Hite and Dan Dunlop. All right, Dan, I'm going to throw this next question to you, which is how should hospitals and health systems be pivoting their brand messaging? So kind of the brand messaging strategy, how should they be pivoting that? What should they be talking more about and less about?
Yeah, it's important. I think as they're strategizing, looking at this hopefully ending soon, I think you need a plan as a hospital for how do we come out of this? How do we recognize the contribution of the community? How do we recognize the contribution of our healthcare providers, of all of our employees? There needs to be a plan for that. How do you exit this COVID-19 disaster? And then how do you ramp up your traditional marketing? And I think one of the ways you do that, one of the ways you make that transition in messaging, because it could seem crass if all of a sudden one day you're doing COVID-19, the next you're marketing some kind of elective procedure or whatever. So you want people right now thinking about the hospital as their year-round healthcare provider. And so the idea is, and as a safe option for healthcare, because a lot of people, I would assume, when this is over, are going to be fearful of going to healthcare facilities because they're going to think, my gosh, that's where I could get the virus, even though the virus is gone and no longer an issue at that point, or at least hopefully gone. So we want to start putting people at ease. And I've seen some people doing a really good job of this, promoting themselves as your healthcare provider in good times and bad. Reminding people that we're there when you're having babies. We're there when you have a broken arm. And we're there when you have COVID-19. I mean, that's the truth of it. But it's important, I think, to keep that context there, not just to be the COVID-19 provider. That you are their provider for a lifetime of care. I saw this morning on Facebook a hospital. I'm looking. I made a note. Where is? Copley Hospital in Morrisville, Vermont, had a little Facebook ad in their news stream, and it said, "We continue to serve." And I thought that was such a nice message, and they're not just there for COVID-19, and that's the message. And last week they ran a similar message, which was, if you're really ill and you need help, come to the hospital. We're not closed. We're not only dealing with COVID-19. Now, we hope most of you don't need to come to the hospital and have something that won't require that. But if it's emergent, please come, and there's no place better to deal with that than your local hospital. So I think in the communication we do today around COVID-19, we can be laying the foundation and reminding people that we are their provider day in and day out, not just in a crisis.
That's great. Haley, what do you think?
Yep. So I think right now, where we're at right now, brand messaging definitely shouldn't be about business building right now. For the time being, it's not, come here to get your knee replaced or have bariatric surgery or whatever. I think we all know that. Yeah. But I think messaging should still be made relevant to what's happening, and it can still relate to both the pandemic and your hospital's mission. We've seen quite a few examples of hospitals doing a really good job of this. Texas Children's Hospital is one of them. They recently published a blog on the importance of breastfeeding during a pandemic. So, they know the topic of breastfeeding. That's their expertise, being a children's hospital, but they're tying it back to what's going on right now and what's on people's minds. Because right now, to be honest, people are worried about this. It's really hard to get your mind off of it and to feel comfortable, I guess, thinking and researching other things when you can't stop thinking about what's happening in the world. So they're meeting their audience where they are while still being relevant to their mission. Shriners Hospital, they had a social media post, I think it was Instagram, about National Puppy Day, something, who could tie that to COVID, right? But they tied it to stress relief and how animals are there and help de-stress us and all that, being home more often, be with your animals, get that stress out. So they still made it relevant, and it's something that's more uplifting, empathetic, kind of ties at the heartstrings a little, but it gets their name out there. So doing things like that, things that are going to make people feel a little bit more upbeat, but still, I guess, promotes your hospital in a way, you're still out there, you're visible to your audience. Things like that are what should be happening now and moving forward too, not just strictly the overwhelming, I guess, kind of depressing content about COVID and what's happening in the world.
For sure. So what I'm hearing you both saying is that we have permission to find ways that it makes sense to share this message of continuity of care. There I go with jargon again. My bad. But the thought that we are there, we were already there. We're there now, and we'll be there in the future for you. I think that does say a lot, and that does make sense in terms of something that communicates your care for the work that's going on now, your appreciation for your frontline workers. There's a significant thank you message that needs to be part of our brand messaging. And what I heard in both of you, those examples, there are ways to do that still help people realize what's going on in the past and the present and the future. So.
Yeah. That actually brought to mind one more thing, if you don't mind, Jared. One of the examples I saw, it's not a hospital actually, Dave Ramsey Solutions, his company, they post periodic good news updates related to the pandemic. It could be like vaccinations that are in the work, or like you said, statistics on healthcare workers that are coming out of retirement, or like anything like that. It's still related, but it's good news, you know, like let's get some good news out there. Let's get some good stories, some inspirational things that are happening in the world to kind of keep us all going. You know, we got to get that motivation to keep moving forward.
Yeah, that's why I think it's so important right now for hospitals to be pushing out some positive news related to the crisis. So thanking local businesses for making donations of masks and surgical gowns, whatever it might be, listing the donors, doing a Facebook post that lists the donors, you know, celebrating those. I was talking to a hospital in Maine this morning where they've had 3,000 masks donated in the last week, and I can't remember how many gowns, but it was some huge number. And they're running Facebook posts celebrating that and thanking the community. So it's a nice time for really extending that relationship with the community and tightening that relationship with the community. So when you come out of this, you come out with that stronger bond, because people don't like to think about us day in and day out. Hospitals are not people's favorite thing to think about. But right now, they're very top of mind, and healthcare workers kind of have this halo around them. So I normally am not a huge fan of using healthcare workers, doctors, or nurses in ads, because I think it's about the patient in the end. But coming out of this crisis, I do believe we will use more healthcare workers in our advertising, because they do carry with them that goodwill coming out of the crisis.
Cool. All right. Well, so we're on to kind of our final thoughts, anything that we haven't really touched on yet for healthcare marketers and communicators to keep in mind that will help them both now during the crisis and in the future in the post-pandemic world, whenever that's going to be. I'm not asking for predictions on when that will be, but Haley, why don't we start with you? Anything we haven't touched on yet?
Sure. So speaking to healthcare marketers directly, I know you guys are putting out fires constantly. You're scrambling to be relevant right now. You're scrambling to do what you have to do, what your leadership wants you to do right now. But this is definitely not a time to forget best practices, right? We got to remember those. It's not a time to forget about what your audience truly needs from you. Even if your C-suite is telling you to get info up on your website as quickly as possible, just throw it up there. You know, maybe they're saying that. Do it in the right way still. Make sure you're following those web writing best practices. Use plain language. Use images that convey empathy and expertise, not fear. Stop using that image of COVID.
Oh my gosh.
It's everywhere. But use formatting, break up your content, subheads, bullets, include links to other pages so that you're not just plastering this huge chunk of content on your website. Still think about your user experience. I know it takes a little bit more time, but you can't throw that out the window because it still matters. Put thoughts behind your efforts, no matter how crazy things are right now, because in the long term, it'll pay off. It's going to help. It matters still.
Thank you. Dan.
Awesome. I don't want to follow that one. For the last 2 years, I've been on a rant about healthcare marketing where we just spew useless content, and it's stuff about us. It's not relevant to the consumer. And what I want is people to think of marketing as community building, to go to work every day thinking, I'm going to build community with these audiences. And if you do that, you stop spewing crap and you start focusing on being helpful and useful, and providing information that people really value. And suddenly you're of value then, and people start noticing your communications and absorbing that communication. And we've been given a gift in this pandemic, in that we are now more connected as hospitals to our communities than we ever have been. There's nothing like a crisis to bring us together. And that truly is a gift. When I preach about community building, people wonder, oh, how am I going to do that? Well, man, the pandemic has done it for you. We now have communities that have united. I mean, people all over the country are sewing masks. My wife is sewing masks in our living room right now to donate to local hospitals and other healthcare organizations. So we have this gift. So let's take advantage of it moving forward. And embrace it, and make sure we celebrate the community, as we come out of this crisis. And then moving forward, let's not let that community building that's happened over the last few months slip away. Let's use it as an opportunity to really jumpstart future community building that we're going to do. So take those relationships. Put up a darn plaque inside the hospital recognizing all the people who helped you through the COVID-19 crisis. Celebrate those people. Do a banquet. Really take that community that you've built during this thing and carry it forward with you. Don't just leave it behind the day the crisis is over.
Such a good point. I can visualize that type of thing, and hopefully we'll see providers take that into account. And this really is the time to get some extra traction by thanking those in the community and building a community in that way. I think if I had to think of one other thing, it would be to recognize that whenever things do open back up and kind of start getting back to a status quo of some kind, that it's also an opportunity to open up yourselves and try new things that you haven't done before, or that you've talked about and just haven't had the impetus. Telehealth, telemedicine is the perfect example where, look, we may have talked about it and researched it and thought about it for years, and it just didn't come to fruition for whatever reason, and now we're scrambling. So that's a non-marketing example in most cases, but in the same way with marketing, what tactics, what messaging have we wanted to share? Have you wanted to do more thank you messaging for your community or for employees or for patients and just haven't done it? Well, now might be the time to try that while we're recognizing that there is no normal anymore. So that'd be the thought, is just recognize how this really is the time to open up and actually try some of those things that you've been wanting to. And everyone's going to have more leeway that way. I feel like, even as in the midst of if it's a 25% revenue reduction, everyone's going to be scrambling anyway. So to have any of these pieces together as we kind of put all this together into what that post-pandemic plan is, I appreciate your thoughts and your time to both of you, Haley and Dan. Thanks so much for joining the conversation, for giving us a lot to think about.
Yeah, thanks for having me.
So thank you for tuning in. Thank you for joining Now What? We have future episodes coming along the way, so keep an eye out for that. This series is produced by the Shift.Health Network, the infotainment media network for healthcare marketers to challenge the way of thinking and help them lead meaningful change. Thank you for tuning in.